medical field is transforming with several ways of treatments. However, homeopathy maintains its importance and effectiveness. Unique features like targeting the root cause of disease with providing complete cure for the patient is something that has been the reason of homeopathy's popularity even today. Due to increasing awareness, a large number of patients are opting for homeopathy, from the common man to the elite class. Experts of homeopathy, on the basis of their research and meticulous and sincere efforts to help patients get remedy, are not only finding solutions for several serious chronic diseases and helping patients live a normal and healthy life, but also creating large-scale public awareness about this treatment. Dr. Vijaykumar, one of the most reputed homeopathy practitioners of the world and the founder and CEO of modern homeopathy, has been practicing for more than 2 decades and has been successfully curing numerous patients with serious and chronic diseases through his extensive research and innovative treatment methods. He is also helping patients to regain self-confidence and live a happy and healthy life. Dr. Vijaykumar started his medical career as a lecturer and did extensive researches on traditional treatment therapy and invented simple curative line of treatment named modern homeopathy for several incurable diseases and gave relief to numerous patients. His journey began around 1998 from Kolhapur and steadily it spread to other parts of Maharashtra as well. Soon, patients from other states of India as well as patients from around the world started visiting him and consulting him for his treatment. No doubt, his innovative ways soon proved beneficiary for the patients. Modern homeopathy's curative line of treatment has come into existence through thorough research, vast experience, and a huge database of successful case histories of patients of Dr. Vijaykumar. His continuous efforts to excel and steadfast research for further innovations, searching solutions for the patients with the most complicated symptoms have been the reason for his success. Dr. Mane is continuously working towards inventing new, effective treatments and innovative medicines of various serious and pathologically advanced diseases like cancer, kidney failure, liver cirrhosis, diabetes, asthma, arthritis, and other incurable diseases. Modern homeopathy is also designed to manufacture and produce medicines formulated and innovated by Dr. Mane. Medicines which are found both in liquid form and in globules and are easily consumable and highly result-oriented.
Hello, I'm Dr. Mrinmai and welcome to your favorite health series, Healthy Era with Modern Homeopathy. As we all know, kidneys are important organs of our body because they do the work of excretion. But if this work hampers, what happens to kidney? Today, we are going to talk about kidney diseases and specifically we are going to talk about diabetic nephropathy. We are glad that we have with us today Senior Consultant of Modern Homeopathy, Dr. Jyotsna Lad. Hello ma'am and welcome to the show.
Hi Monu.
Ma'am, as we see that kidneys are very important organs of our body, what importance kidneys carry in our body?
As you rightly said, kidneys are most vital organs of human body. Actually, malfunctions of kidney may cause serious illnesses, even death. Okay. What is prime most function of kidney? That is filtration or purifying the blood. What kidney does exactly? It purifies the blood and it excretes waste product like urea, create and extra water from our body and maintains our body in clean the environment. Along with excretion, there is also some major functions of kidney, that is it synthesizes vitamin D3. Also it secretes erythropoietin hormone and it maintains and controls our blood pressure. It keeps our bones healthy. These are other functions and along with that electrolyte imbalance will be also corrected with our kidneys only.
Okay, so many functions are there of kidneys. So if anything is hampered in kidney function, then it may lead to some disease?
Yeah, there are two categories. Mainly there is acute kidney failure or ARF we can call, and other one is chronic kidney disease. In acute kidney failure, there is some acute cause or acute emergency will be there. There may be hemorrhage, which is massive. There may be snake bite or poisonous insect bite, or there may be malaria. In malaria also, kidney may get acutely damaged and it recovers on its own with only few dialysis. In chronic dialysis, that is not the thing. In chronic dialysis, kidney function slowly declines and it step down in GFR values, and which is normal GFR values 90, above 90 ml per minute. It is normal GFR, but it declines up to 15 ml. In acute and chronic, in both diseases, kidney functions will be deranged. But in acute, it will recover.
It will recover on its own.
On its own and in lesser time.
Okay.
Otherwise, on extremity, chronic kidney disease will not recover on its own, and with only conventional line of treatment is not going any assurity and any future for kidney disease, chronic kidney disease specifically.
Okay, what kind of conventional treatment is given generally?
And there are only two options in conventional line of treatment. One option is dialysis, which should be done by patient lifelong, and it has many side effects. That it may cause intracranial hemorrhage during dialysis. It may got myocardial infarction, that is heart attack, and other symptoms are other side effects of dialysis are there may be less hemoglobin. Hemoglobin loss will be there.
Okay, due to dialysis.
Due to dialysis, and along with that, it may cause low sugar levels and low blood pressure levels. And it is not curative treatment exactly. It is a temporary life-saving procedure, which actually kidneys are not filtrating and not excreting urea create.
Correct.
The machine is going to excrete for a time being only. For 8 to 10 hours, your blood will be purified. Again, after 10 hours, 12 hours, 4 days, again urea and create return inside our body. And again patient has to go for next dialysis session.
Yes. Madam, as we know that diabetes is growing by leaps and bounds, not only in India but all over the world. So it is very important to know the effects of diabetes on kidneys.
Long-standing diabetes may worsen kidney function and it affects kidneys badly. Long-standing diabetes, if it is uncontrolled diabetes, if sugars are more than 200, if sugars are up to 200, there is no any problem for kidneys.
Okay.
But if sugars are fluctuating, one time its sugar is 350, another reading is 300, another reading is 250, then it will hamper kidney badly and patient may land into diabetic nephropathy.
So what can you say about diabetic nephropathy, how serious it is?
Diabetic nephropathy is a very serious illness as it is a progressive disease, and in terminal stages it will require definitely dialysis, and there may be proteinuria, which is the first indication.
Now what is proteinuria?
Actually, proteins, these are large molecules, they are needed by our body. But in diabetic nephropathy what happens, nephrons get damaged and so proteins lose through urine, and there may be proteinuria which is persistent, which is 1+, 2+, and because of hypoproteins.
So in our urine you can see proteins.
In urine only you can trace it, proteinuria you can trace it out.
Okay, what other symptoms we get?
There will always hypertension. If any diabetic patient had diabetic nephropathy, then within 1 or 2 hours he may also develop hypertension.
So this is also one of the consequences, or you can say side effects of diabetic nephropathy?
Because of accelerated hypertension, it will again cause kidney damage and it will worsen kidney function, and it will affect kidneys badly.
So diabetic nephropathy, as you said, it is a serious illness and we need to treat it immediately. So what kind of treatment, what kind of conventional treatment do we have today?
We have today, as earlier said, that is dialysis and transplant, and that is not a curative line of treatment. In homeopathy, in modern homeopathy, when patient consults us, then we will start him our curative line of treatment. With our treatment only, symptoms get declined from the day first, and first month only patient is symptom free, and slowly reports always come down, and reports decline, urea create reports get declined, and it improves kidney filtration rate. There is always improvement in GFR, which is an indicator of kidney function, and which indicates that kidney is functioning, going to function normally.
Okay, so you said that this is a very serious disease, and with modern homeopathy we can not only treat but we can reverse the disease also.
We can reverse totally. We can reverse diabetic nephropathy. In any stage, patient if consult us, then we are going to start him curative line of treatment. We are going to skip. We are going to advise him to skip dialysis. We will minimize dependency of dialysis, and in last stages, we will totally stop. Patient will dialysis free. He will enjoy his dialysis free life.
Definitely, this is very interesting and we would like to know more about this. We will speak more about diabetic nephropathy right after the break. Welcome back after the break. You're watching your favorite health series, Healthy Era with Modern Homeopathy. Today we are talking about diabetic nephropathy. Bhausaheb Nevrekar, a patient who is 72 years old, he was diagnosed with diabetic nephropathy. He approached modern homeopathy for the treatment with a beam of hope. Let's see what his reports are and let's see what he says.
Bhausaheb Nevrekar, aged 72, is from Pune. Diabetes caused a decline in his kidney function in 2005. Experts diagnosed kidney failure.
मला एक छोट्याशा टेस्टमध्ये असं समजलं की मी किडनी फेल्युअरचा पेशंट आहे. त्याची खरं कारण होती म्हणजे मी माझं हिमोग्लोबिन खूप कमी राहायचं आणि पेन किलर मी जास्त घेत असे.
After being diagnosed with kidney failure, Nevrekar sought treatment from holistic, Ayurvedic and nephrologist for 3 to 4 years.
2 नेफ्रोलॉजिस्ट, आयुर्वेदिक, होमिस्टिक आणि स्टेम सेल अशा सगळ्या ट्रीटमेंट मी घेतल्या होत्या.
But instead of improving his kidney function, it actually worsened. His creatinine was increased to 2.9. His health was deteriorating day by day. Experts advised Nevrekar to start dialysis, but Nevrekar decided not to do dialysis.
बहुतेक नेफ्रोलॉजिस्टने मला डायलिसिसकडे नेण्याचाच प्रयत्न केला. तेव्हा मी थोडासा चिंतित होतो आणि मी एकदा पाहिलं होतं डायलिसिस करताना. तेव्हा ती जी पद्धत आहे ती पाहून मी 2 दिवस तरी मला चैन नाही पडली आणि मी ठरवलं की आता मला डायलिसिसकडे जायचं नाही आहे.
In such a situation, he could not go out anywhere. He was at home for 2 years.
सगळं लक्ष त्याच्यावरती, घरात अडकून पडलो होतो मी, कुठं जाणं नाही येणं नाही अशा पद्धतीचं होतं.
Mr. Nevrekar started modern homeopathic curative line of treatment in November 2010.
तेवढ्यात मला मी कोल्हापूरमध्ये असताना एक माने सरांची ॲड मी पाहिली. त्यांना जाऊन भेटलो मी लगेच आणि पुण्यामधला त्यांचा पत्ता मला त्यांनी दिला आणि तिथे मी त्यांची औषधं घ्यायला सुरुवात केली.
His health made a difference from the first month after starting modern homeopathic curative line of treatment. Nevrekar wasn't able to go out for 2 years due to kidney failure, but he went on a foreign tour in a very first month after undergoing modern homeopathic treatment.
2 वेळेला 3-3 महिन्यासाठी ऑस्ट्रेलियात जाऊन आलो, भूतानला जाऊन आलो की इकडे कोकणामध्ये फिरतो सगळीकडे.
The treatment of modern homeopathy has greatly reduced his diabetes and increased his kidney function.
आणि मी कोणत्याही हॉस्पिटलमध्ये छोट्या मोठ्या कारणासाठी ॲडमिट झालेलो नाही आजपर्यंत. कारण माझे मेटाबॉलिझम हे अगदी मजबूत आहे. हे फक्त केवळ डॉक्टर विजयकुमार माने यांच्या औषधामुळेच शक्य आहे.
For the last 9 to 10 years, since the introduction of modern homeopathic medicine, he didn't have any problems and has not been admitted to any hospital.
त्याची औषध घेण्याची पद्धतही साधी सोपी होती, जी की आयुर्वेदासारखी सकाळी उकळून घ्या, तापवून घ्या. त्या दिवसभर घरामध्ये राहावं लागायचं 3-4 वेळेला. ते न राहता हे कॅप्सूलमध्ये त्या गोळ्या देत असत आणि ते घेऊन मी पुढे माझं कुठलंही काम मी करू शकत होतो. आणि एक कॉन्फिडन्स आला की मी कोणतंही काम बाहेर जाऊन करू शकतो. मला आता घरात थांबायची गरज नाही आहे.
His creatinine is stable at 2.0 and he is still living a normal and happy life free of dialysis. All these was made possible by modern homeopathy curative line of treatment.
Mr. Bhausaheb Nevrekar is now totally cured of his diabetic nephropathy and he is fit and fine. We would like to know more about this case. We'll know about it right after the break. Welcome back after the break. You're watching your favorite health series, Healthy Era with Modern Homeopathy. In last segment, we saw experience of Mr. Bhahu Sahib Nevrekar, and we are going into details of that case. Ma'am, that patient had come to you with diabetic nephropathy and today he is absolutely fit and fine. So what will you say about this case?
This gentleman was 72 years old, and he was a known case of diabetes since long. And then he landed into diabetic nephropathy. For diabetic nephropathy, he has already taken conventional line of treatment. He had already consulted to renowned nephrologist, also taken holistic, herbal and Ayurveda drug. And, but no relief was there.
Okay.
Then his create levels were going on increasing day by day. Then he and his family members are very much worried because diabetic nephropathy, one day it will end into dialysis only. That they know it very well. Then once after inquiry, they consulted to us, and we did his case study in detail, and then we started our curative line of treatment. With our curative line of treatment, from the first month only, create gets declined, and till that it doesn't increased.
Wow.
Actually, diabetic nephropathy is a progressive disease. Create will going to increase only, and it will not going to decline at any circumstances.
So at its own it won't stop or it won't decline?
No, at any circumstances it will not decline. But with only our line of treatment, it get declined, and patient is living healthy, happy life since last 12 years. He totally cured from diabetic nephropathy. His disease get cured and reversed.
Did he need any kind of follow-up after this treatment?
He was doing follow-up for 4 years, 4.5 years, and now he is medicine free also.
Definitely, diabetic nephropathy is a challenging case, especially when you have to prove it with reports and with symptoms both. So, do we need some hospitalization for the treatment?
This is speciality of our treatment, that there is no need for hospitalization, no need for admission. It is OPD basis treatment, and medicines are palatable. Patients can take them at their home, and they are in the form of sweet pills, otherwise in the liquid form. They can take it easily, and it is without any side effects, and curative line of treatment is there. It is out of research we have done it, so it is safe and it is gentle over critical diseases, and it will cure your disease totally. It will eliminate your disease.
Definitely. You must have seen many patients of kidney diseases, acute renal failure, chronic renal failure. And when patient comes back to you with the cure, then definitely that moment must be amazing for you all.
That is great satisfaction that we have done our job very greatly. And patient satisfaction and patient's happy face is really very much satisfying us.
What will you say to the patients who are suffering from kidney diseases, acute or chronic?
Do exercise daily, avoid junk food totally, and do meditation, do mental stress, some activities that will release your mental stress. And if you are diabetic, you should control your diabetes nicely. If you are hypertensive, then blood pressure values you should strictly monitor and keep a close watch on blood pressure and diabetic blood sugar levels.
So, patients who are having prolonged diabetes, should they undergo with any routine tests for kidneys?
They should undergo screening. All screening tests are mandatory. In foreign countries, screening tests are mandatory. In India, that is not the issue right now. But we should concern more about screening test, because in screening test it will you will catch the disease in very early stages and you can cure it at its root. CBC is mandatory because anemia will be there in diabetic nephropathy or and chronic kidney disease, and another renal function test. They are also mandatory because urea create levels will fluctuate accordingly. Diabetic nephropathy worsens. And thereafter urine protein create ratio, urine for microalbumin and glycosylated hemoglobin. These are mandatory tests which one patient should do.
Okay, how frequently patients should do these tests?
Actually, you can do urine protein create ratio and urine for microalbumin, that once in 6 months.
Once in 6 months,
in
all
6
diabetic
months.
patients?
Yes, all diabetic patients needed to do that. And glycosylated hemoglobin, once in 3 months you should do that. And you should consult your ophthalmologist for diabetic retinopathy, which is also life threatening, otherwise which is also a threatening complication, because you may become blind if diabetic retinopathy, if you are not going to consult or you are not going to get treated for that, Then for diabetic retinopathy to avoid, you should consult your ophthalmologist once in 6 months.
Okay, when we say diabetic nephropathy, as you said, in conventional kind of treatment, only dialysis is the option or transplant, which is not possible for all the patients. And when they know all about this, they lose hope. When they come to you, do you do some counseling with these patients?
Counseling is needed for such patient because they are in grave situation. They are suffered badly, and in allopathy, in conventional line of treatment, there are no hopes. They come to us with great hope, and we satisfy them. We counsel them. We tell them how to what to do and how to become dialysis free and disease free. You should, we also recommend them to follow dietary restrictions strictly. In dietary restriction, we are going to tell them less oil, less salt and less water. This
Less oil, less salt and less water for all patients.
And avoid junk food, avoid sweets. These are homely advised by us.
Okay, and the main thing is they should control their diabetes.
Diabetes and blood pressure, both metabolic disorders, you should control very well.
Okay, so diabetic nephropathy, when we speak about diabetic nephropathy and patient is in later stage, still it can be reversed?
Still it can be reversed with regular follow-ups, with strictly dietary restrictions and with under guidance with us. You can totally reverse diabetic nephropathy in terminal stages also. Most of patients consult us when they are undergoing dialysis. Otherwise, they have get advice of dialysis. Then they frighten and then consult us. At that stage only, we are going to become them dialysis free.
Okay, so if the patient comes early, they will get early treatment and early reduction in
course
symptoms.
Of duration, treatment course, it will lessen if patient consulted us in early stages.
Thank you so much, ma'am. We really got great information in this interview. Thanks for being here today. If you have any query about diabetic nephropathy, any query about any kind of kidney disease, or if you want to know more about modern homeopathy, you can call on the numbers displayed on your screen. So for today, here we take leave. Goodbye and take care.
Our address, Modern Homeopathy Research and Treatment Center, E Ward near Gita Temple, Kawalanaka, Kolhapur 416003. For counseling and guidance, contact at our centers below: Kolhapur, Dadar, Kalwa, Thane, Dhankawadi, Pune, Pimpri, Chinswar, Nashik, Aurangabad, Nagpur, Solapur, Goa, Madgaon and Mapsa, Karnataka, Bangalore and Hubli, Telangana, Hyderabad. For counseling and guidance, give missed call at 70388-33881. You can also contact us on 9730339009 or at 9372728009. Our toll-free number is 1800-121-8009. Our website www.modernhomeopathy.com. You can also email us at contact@modernhomeopathy.com.